PowerPoint is on Adjuvant Olaparib for patients with BRCA1 or BRCA2 mutated breast cancer. It's Emily Sims, Emily Dickey, and Zan Wright. Just some terms before we get started. First one is adjuvant therapy. It's additional treatment given to the cancer patient after the main course of treatment. It can be a variation of medication, chemotherapy, or radiation. The BRCA gene is whenever a patient is BRCA positive and they have a higher risk of developing breast cancer compared to someone who doesn't have BRCA1 or BRCA2. And being BRCA negative means that the patient does not have a mutation in the BRCA gene. HER2 refers to human epidural growth factor receptor 2. It can refer to the gene HER2 or the protein which the gene makes. HER2 proteins are receptors that sit on the surface of breast cells. They usually help control the growth and repair of healthy breast tissue. However, when the HER2 gene becomes faulty and starts making too many copies of itself, it overproduces HER2 proteins on the surface of breast cells, causing HER2 positive cancer. And neoadjuvant therapy, it's the opposite of adjuvant therapy. This is medication, chemotherapy, or radiation given before the main course of treatment in order to shrink a tumor. Triple negative breast cancer is whenever the three main receptors usually found in breast cancer are not there, which are estrogen receptors, progesterone receptors, and large amounts of HER2 proteins. And that leaves doctors with fewer options for treatment other than chemotherapy or invasive surgery, and that's why they may be interested in a trial such as Olaparib. Invasive disease survival is a composite endpoint that is describing a group of women who are alive and free of any breast cancer or any type of cancer. And distant disease-free survival refers to the time from treatment until the reoccurrence of disease or death after undergoing curative intent treatment. And some background, polyadenosine diphosphate ribose polymerase is a protein or gene that repairs cells when damaged. Olaparib would prevent or inhibit PARP from repairing cells that are cancerous to prevent the cancer from spreading. By preventing the cell repair, it stops cancer growth and causes the cell to die. PARP is also found in healthy cells, not just cancerous ones, so Olaparib may affect the healthy ones too, but new therapies like Olaparib are needed to reduce reoccurrence in patients with the BRCA gene. Olaparib was the experimental drug used in this study and is a PARP inhibitor. Olaparib works by blocking the activity of PARP proteins, stopping activity of DNA replication in cancerous cells, and prevents cancer growth. Olaparib is used as different types of treatment as of 2022. It is used for maintenance therapy, active therapy, and adjuvant therapy.
Hi, Other Emily here. First, this test was conducted by Breast International Group and the sponsors NRG Oncology in the United States, and AstraZeneca, a biopharmaceutical company who provided the drugs for the trial, Olaparib and placebo. The trial was amended by the Declaration of Helsinki, an ethical principle regarding human experimentation. For the hypothesis, they predicted that out of both drugs prescribed, Olaparib will have a better outcome of reducing the reoccurrence of breast cancer with patients with BRCA1 and BRCA2 gene. They thought because patients with the pathogenic genes have been tested to have a negative for HER, which causes them to lack repairment in the breast tissue. HER2 negative is important to the trial because they tend to grow more slowly. They can also lead to the cancer cells from coming back and stop from spreading in the body. Also, BRCA1 and BRCA2 have proteins that are important for DNA repair and homologous recombination. Olympia trial was designed to test the efficiency of adjuvant PARP inhibitor therapy with Olaparib in patients with early breast cancer and impaired BRCA1 or BRCA2 homologous recombination function. For eligibility, first one, you had to have BRCA1 or BRCA2. This was done by local testing and patients were at high risk. For the second one, you had to complete all local therapy, including radiotherapy, chemotherapy, in others for at least 2 to 12 weeks before the trial starts. Lastly, HER2-negative primary breast cancer after definitive local treatment in neoadjuvant or adjuvant chemotherapy. Neoadjuvant is when patients went through chemo and any other type of treatment done by the doctors. Since this is a phase 3 trial, meaning this is their last resort to try and reduce the size of the tumor or even get rid of it, they have to have gone through all 6 cycles of neoadjuvant or adjuvant therapy. Lastly, a total of 82% of patients had triple-negative breast cancer. For the trial, it took place June 2014 through May 2019. They had a total of 1,836 patients, including 6 men. The patients were chosen at random and recruited from 420 centers across 23 countries. Patients were given 1 year of oral Olaparib or placebo. They received Olaparib and placebo tablets of 300 milligrams, which had to be taken orally twice daily for 52 weeks. Lastly, the physical examinations were performed every 4 weeks for 24 weeks, and then every 3 months for 2 years, and then every 6 months after 3 to 5 years.
So for the results, these 3 charts show a good idea of the number of people in both the Olaparib and placebo groups and the percentages of the survival rates. So in chart A, which is in the top right, it shows the invasive disease-free survival. So it shows the patients who had the disease-free survival directly following. And so it shows that 85.9% of patients who received the Olaparib had disease-free survival. And then the placebo group showed 77.1%. So there's obviously a drastic difference. It's about 8%. And then in the distant disease-free survival, it shows 87.5% for Olaparib and then 80.4% for placebo. So here the percentage is not as significant of a difference, but it still is about a 7% difference. And as Emily explained earlier, distant disease-free survival basically means when someone is surviving and then has a recurrence of the cancer. And then the final chart is the overall survival, and that just is basically a combination of the 2 charts. And it shows that overall, 92% of people who received Olaparib versus 88.3% who received placebo had survival. So, as I said earlier, the percentages for the 3-year invasive disease-free survival was 85.9% in the Olaparib group and 77.1% in the placebo group. So this shows that there was a pretty significant difference in the 2. Olaparib was also associated with fewer deaths than the placebo. However, there is not enough evidence to really show that it's a direct causation. It doesn't have as much significance. So we aren't 100% sure that Olaparib is the reason that there are fewer deaths or if it was just a matter of coincidence. And then the primary cause of death for these patients was breast cancer. So it didn't necessarily have to do with these side effects. It was like from the actual breast cancer itself. So the side effects, while were severe, were not severe enough where they often caused death to the patients. So patients who took Olaparib ultimately had better outcomes, not just for survival, but also in terms of recurrence. Patients who received the Olaparib drug were less likely to have breast cancer develop again versus the placebo group. Olaparib did, however, come with some adverse side effects, and some of them were grade 3 or higher, which meant that they were pretty severe, and a lot of them included anemia, decreased neutrophil count, which is a type of white blood cell, decreased white cell count overall, fatigue, nausea, vomiting, headache, diarrhea, dysgeusia, which is basically an effect in your taste, dizziness, and arthralgia, which is joint stiffness. And overall, this trial did show that Olaparib can be an effective form of treatment when accompanied with treatments like radiotherapy, chemotherapy, surgery, and all of that. However, it doesn't really support the idea of Olaparib being a good standalone treatment. This trial more showed that it would be a good treatment to partner with other treatments that we already have for these types of breast cancers. But it does overall increase people's chances of survival for such an invasive disease. There will need to be more research to be conducted to get further details on whether it actually will help with other types of breast cancer, if this only really applies to BRCA breast cancer. But if hypothetically it also would be able to target certain mutations in other genes, it could possibly be used for other cancers too, which is incredibly important because cancer is such a big disease, not just in the US, but all around the world. And there are also so many different types and variations. So if we can figure out a way to even just alter this drug a little bit to fit these different cancers, we could make great strides in breast cancer treatment and cancer treatment overall. We thank you guys so much for listening to our presentation, and we will send you the questions at another time.